Okay, we're going to show you the absolute best hack for extractions. The absolute best technique that took me from literally hating extractions, hating seeing them on my schedule, to loving them, getting teeth out immediately. So when I used to do extractions, I'm a very gentle dentist. So I don't love the idea of jerking their head around because I don't put my patients under, I just locally get them numb. So they're not feeling anything, but I don't love the idea of how you're supposed to do an extraction is you're supposed to really push on the tooth. So you're expanding the socket, you're expanding the PDL by actually pushing down. So when you grab your forceps, you're supposed to be pushing pretty hard in order to expand that socket and give the tooth enough space to extract. And I don't love that idea, so I always go in there very gently, which makes it so I can't get quite enough movement a lot of the time, and then I need to go to my handpiece more often, or it takes me a while, or I end up having to push harder than I want to because the tooth isn't coming out. So I found this out a couple of years ago, and it has absolutely changed my life when it comes to extractions. And so it is a machine, and it's a little expensive. I'm not sponsored by this company at all. There's many different brands. Get whichever one you want, but it is very, very helpful, especially for those tough extractions, especially for those ones that make you nervous and make you not want to take them on. And so the machine is one of these bone cutting ultrasonic machines. So I initially got it for sinus lifts and surgeries because it's really nice for extractions too. What's great about it is that it cuts bone without damaging the soft tissue. So if you have like a difficult to reach third molar, and instead of getting your burr in there and possibly nicking the gums or getting the gums caught in the burr, this doesn't affect the soft tissue at all. You can actually touch this with your fingers and it doesn't cut, but as soon as you put it on something hard, it melts right through it. So it's cutting through vibration, so it only works on hard structures, which is why it's initially the biggest thing that this is used for is sinus lifts, because you can cut the bone without cutting the sinus membrane. Obviously you can cut the sinus membrane if you push hard enough, but if you're going in gently, you can cut the bone, leave the sinus membrane undamaged, and you can do the surgery much more predictably than if you're using a burr and need to watch out for your depth and watch out for cutting the membrane. Obviously, you still need to watch out for those things if you're doing a sinus lift, but that's the idea of it. That's initially why it's being used in dentistry for the most part. But it has one of these very special tips that has absolutely changed my life in terms of extractions. And this is the tip here, and it's basically like a periotome. It's very slender, very slim, slips right in the PDL, but instead of the periotomes where you either have to push really hard or use a hammer, this one works much, much better and much more gently. And so what you do is you use this to strip the PDL. So it's very slender, just like it is here, and you angle it into the PDL, making sure to touch it against the tooth, right? It will cut bone. So you don't want to just put it in the middle and push down because it'll cut through the bone. But if you angle it towards the tooth and push down, and when I say push, I'm talking about very gently, kind of a little bit harder than if you perioprobed, and you push down and it will slide down 10 millimeters. It will slide all the way down. So this is not like I'm hammering it in there. This isn't like I'm pushing and getting a little bit of the PDL separated. It will drop as far down as you want it to go. So you put it in here, push it down, turn it to the other side. This does need irrigation. Put it in and you can strip the entire PDL that way. And as soon as that PDL stripped, you put in your elevator, you do some gentle elevation, and this will just come right out. When I used to take out upper molars, I never, unless it was very periodontally involved and I could just use my fingers, I never took out an upper molar without sectioning the tooth. With this, I put this in the palatal and I strip the entire palatal PDL, and you can elevate the entire upper molar, all 3 roots, all at once, a lot of the times. You obviously still have to section those teeth every once in a while, but this is a miracle tool. It's a little expensive, but it's absolutely worth it if you struggle a little bit with extractions. If you're one of those people who it doesn't matter, that tooth's coming out in 5 minutes, first of all, tell me how you're doing that, and this probably isn't for you. But if you have any kind of difficulty extracting teeth, this is the best way that I have found to take them out. I've tried those machines like the Easy Extract where you drill it into the tooth and it pulls it straight out. I don't love them. They take so long to set up. They end up crushing the tooth sometimes. You really need an ideal situation to get it done right. This you can use for any tooth. One thing that I will mention is that it does cut bone. So if you're using it in a very aesthetic area, you do only want to use it interproximally like I just showed you, if possible, and you can use it on the palatal, right? But if you're gonna use it on the facial, just know that you will probably lose a little bit of bone. You can do it without. You can absolutely get this done without touching any bone, but there is a risk that you do. So if you're in a very aesthetic area, you're in the front, you don't want to ruin that buccal plate at all, then just use it interproximally as I just showed. If you're using it in the posteriors where you're not so much worried about getting a tiny bit of bone loss, you can use it all the way around, or in general, you can always use it interproximally and you can always use it on the palatal, and it does an amazing job of stripping the PDL, and it gives you a nice little opening to put your elevator in, so you can get so much more leverage, and you can put your elevator in down in this area because this is now has a space, so you can put your elevator in between the bone and the root so that you're elevating off of the bone and the tooth instead of elevating up here where you're elevating off the adjacent tooth, because I am very worrisome about the other tooth as a general dentist, right? Oral surgeons, that's all they do. If the other tooth breaks, it's kind of part of the job, you know? When an oral surgeon breaks the tooth beside it broke, you know, it's part of the risks of getting the extraction done. When you're the general dentist, there's not as much leadway with that kind of thing. You know, you're expected to do things very gently. And so being able to put your elevator in lower to avoid breaking that other tooth or avoid pushing off of it at all, it's much, much easier. And this is, I told my assistants that I was gonna have this machine walk me down the aisle of my wedding because this machine is a lifesaver, right? It's a little bit expensive. There's a ton of different brands out there. I only have tried using the surgical one, which is the expensive one. I'm sure you could get a much less expensive one for like a couple $100 that still does a very good job of stripping the PDL. I haven't tried it. So if you do end up getting one of the much cheaper ones, let me know if they work, because I would love to be able to have some insight on that. But this is an absolute game changer for extractions, makes them faster, makes you push less on the patient, makes the risk of damaging the adjacent tooth or breaking the tooth you're extracting much lower. Absolute game changer. Couldn't recommend this technique more.